Hello, everyone. Welcome to our third webinar. We're gonna give the rest of people who registered some time to join. We have already 30 people joining us, so thank you so much. We're gonna start in 1 minute. Wonderful. So welcome. Thank you so much for joining us. Today we're hosting the third GreenME webinar. I'm Antonella Criquinho. I'm a senior project manager at All Continent, who is the communication and dissemination partner of the GreenME project. Today I have two excellent panelists with me. I have Dr. Helen and Dr. Paula de Prado Bert. They're both from the Autonomous University of Barcelona. Helen is our scientific co-coordinator and primary investigator of the project, and Paula is our postdoc researcher. Thank you so much for being with us. Behind the scene, there is also my colleague Olivier, who is gonna make sure that everything proceeds smoothly. So thank you, Olivier, for being here with us. Thank you for joining. It's a pleasure to see how many people are interested in following our work and what we're doing with the project. The idea is to give you a little overview of what's the session is gonna be about today. Just a kind reminder, this is not a lecture, this is an interactive discussion and session. I understand it might be hard to engage when you're behind a screen and you cannot see your face because you just see the panelists up there. However, we kindly invite you to disclose your thoughts in the chat, to intervene whenever you see fit, and to take part in our poll and questions that will be regularly launched during this webinar. The topic we're going to discuss today directly follows our previous webinars. If this is the first time you're joining us, welcome. If you've been here before, you know that we gave a first introduction of the project during our first webinar, then the second webinar with our work package 2 leaders focused on who are the green characters and how we can identify them. Today, we're going to talk about something that is directly connected to that, which means what are the evidence, the causal pathways, the cost effectiveness, and the effectiveness of nature-based therapies, and how do they work? And also, do they really work? The idea is to have a first poll now that we're going to launch, because we want to get to know you and our audience. You will have 2 questions to answer to. It's just multiple choices. So Olivier, thank you for launching the first poll. We want to know what category best describes you. What's your current role? If there is nothing that resonates with you, please select the other option and then specify in the chat. And then, why are you here? What's your main interest in getting to listen to what our experts have to say about cost effectiveness in nature-based therapy? Let's say we have 30 seconds, more or less, for this first 2 questions, and then we're going to share the results, because it's important that you also are aware of who are the people you're sharing this room with. We have 52 participants now, by the way, so great numbers. Hello, John. Thank you for sharing. You are in business development and fundraising. That's great to hear. Couple of seconds more, so we make sure that everybody has answered the poll. Olivier, please feel free to share the results when you see that most people have answered to this. Thank you. Okay, we have people also answering in the chat. That's great. So the main interest in nature-based therapy for Joanne would be other, okay. So learn about what other therapy providers are doing and how to connect with them. That's great. For this, I think, Joanne, if I'm not mistaken, you already expressed your interest in that. But we are growing your EU Green Care Network within our project. So if you're interested in networking and connecting with other nature-based therapy enthusiasts or practitioners or researchers, feel free to send us an email. Exactly. Thank you, Olivier. You can do it. You have all the info in the chat. And I would say that we can close the poll and share the result, and we see who's with us today. Okay, so we have a lot of researchers and academics, nature-based providers, some policy officers or public authority. That's great to have you on board. Healthcare professionals. Okay, that's great. We have some others, and it has been specified in the chat. We have landscape specialists, social farm and gardens representatives. Okay, forest bathing teachers. That's great. Thank you so much for joining. And I would say that, okay, we have diverse range of interests. Okay, we have policy, program design and delivery, understanding how nature-based therapy work. That's great because that's the scope of this webinar, and academic and research interests. That's great. Thank you so much for participating in this first poll. I would gladly give the word now to our panelists, Paula and Helen. Please feel free to start with your presentation, and thank you so much for being here with us.
Thank you, Antonella. So just to get started, today we're talking about our work package focused on nature-based therapies, which is, well, shoot, there we go. So if you attended one of our previous webinars, you might remember that we based the project on a 3-scale idea of something called green care, where we're focusing not just on nature-based therapies, which is a more targeted approach to treating individual patients, but also these other 2 levels, nature in everyday life and nature-based health promotion. Today, we're going to focus on the work package, which focuses on evaluating the effectiveness and cost effectiveness of nature-based therapies specifically. So this most targeted approach of green care. And I also wanted to bring up again that our project also has sort of 3 pillars that we try to implement across the project. First is, and these are very relevant to the part of the project that we're talking about today. The first is about the importance we see in learning from existing green care interventions. And so all of the programs that we're evaluating as part of this evaluation of nature-based therapies are existing nature-based therapies, which they weren't created for the project or designed by us. They were programs that were already in existence, already working and already accepting patients. And so our role has been really to come in and try to do a rigorous evaluation, which we'll tell you more about today, of these existing green care interventions at the nature-based therapy level. Then we also had this approach of using a participatory action research approach, and as applied to the nature-based therapy arm of the project, we really tried to work with the partners, especially those who are implementing these nature-based therapies that we're testing, to get their feedback and perspective on how the evaluation should be designed, and what will or will not work in their setting. And so the design that Paula is going to tell you about more a little bit later reflects those inputs. And then finally, throughout the project, we have a strong focus on health equity and environmental justice. And so although we are focused on whether or not nature-based therapies work for individual patients, we're also really interested in how they could be used on a larger scale to improve health equity and across the population. And so that means how we can think about who might not have access to nature-based therapies. And we particularly are thinking about certain marginalized communities who in general have less access to green resources in general. So first of all, our first step was to do an analysis, to build what we called a theory of change around how we conceptualize nature-based therapy and how it works. And so one of the things that might be surprising, or maybe it's not surprising, probably if you work in the field, you know that it's not surprising, that it's really hard to actually agree on a definition of nature-based therapy, both because it can be a topic that's a bit broad. Even within our project, we have nature-based therapy that take different approaches using either green space or blue space, but also in sort of the details, the fine details. And so one thing, for example, that we discussed a lot was whether nature-based therapy by definition should include the implementation by a trained facilitator. So that's one thing. Another thing is, can they be done indoors, or do nature-based therapies by definition need to be done outdoors? So in the end, as part of this participatory project process, we came up with this definition. So whether or not you agree with it, this definition reflects the input of all the people who participated in our in this process. So the definition that we have is a therapeutic intervention directed by a trained facilitator in an indoor or an outdoor setting that includes exposure to and interaction with nature to enhance individuals' physical and mental health and well-being. So it gives you some insight into the details. It does, we believe, the role of the facilitator is very important in the implementation of nature-based therapy. But it also points to some of the broader aspects. So we felt as a group that it is okay to do these types of therapies indoors. And notice also that this definition doesn't specify the specific activities or the specific type of nature that are utilized by these programs. So as I mentioned before, and Paula will tell you more about later, the nature-based therapies that we're testing in GreenME, so these existing interventions, include nature-based therapies that rely on horticultural type therapies, so gardening types of activities. We also have 2 interventions that are forest related and use a technique called forest bathing, but in slightly different ways. And then we have 1 intervention, a surf therapy intervention, which relates to exposure to blue space for participants. And so we also acknowledge that there's already a lot of existing literature and information going way back about how exposure to green spaces or natural spaces in general are beneficial for our health. And we think that there's sort of, to sum up that research, I imagine a lot of you are very familiar with it, maybe even more familiar than I am. But in general, we have the idea that exposure to natural spaces can benefit human health through sort of passive exposure. So things like improving heat island effect, through biodiversity, through cooling temperatures, through reducing air pollution and things like this. But then it's also very much related to the social aspect of life. So interacting with other people in a positive way, and how that can improve our health. And then we also there's quite a bit of literature about physical activity and how exposure to nature can instigate or can encourage people to be more physically active, which we know is better for health. And then there's also this aspect of stress and restoration that's related to being exposed to green spaces. So these things are not specific to nature-based therapies, but that's just a general way we think about green space or nature and health. So going back to what we wanted to achieve, is our first task was building this theory of change. Well, what is a theory of change? Basically, it's something that tells us how nature-based therapy works. And so when we were thinking about how nature-based therapy works, going back to our idea about focusing not just on individual health, but also on health and well-being equity across the population, we wanted to understand not just how individual therapies work sort of mechanically, but also how scaling up nature-based therapies could ultimately improve health and well-being equity. And so we conducted, as part of this, something called an E-Delphi study, which is basically a way of gathering input from lots of different people and then coming to an agreement on which ideas are both relevant and important to the question at hand. And so to do so, we first gave the participants in this process kind of a statement. We said, we are interested in knowing how nature-based therapy can improve adult mental health and well-being equity among the population at large, and how it can improve adult mental health in general. And then we asked for other potential outcomes or impacts of nature-based therapies. And those included these other two things. So a greater environmental health, conservation awareness, and resilience among the general population, and greater community and social cohesion among the general population. Those are two other impacts that people thought would be. So in terms of what is the theory of change, it's this idea of explaining how and why an intervention might work to achieve a certain impact. So as I mentioned, we kind of established the impact up front, and then we asked participants for their input in terms of these different aspects that lie sort of on the pathway towards this impact. So first, we wanted to know about what important aspects of the context that we work in might affect nature-based therapy's ability to achieve the impact. We wanted to know what kind of activities were important and relevant to include in nature-based therapies so that they can work towards affecting this impact, what sort of resources are necessary and used, and then what sort of results are expected and what sort of outcomes are expected, where those might be a little bit hard to interpret. So we gave these specific questions to the respondents of the survey to help them understand what we were trying to get at. So in terms of results, what we intended to ask for were, what do we produce or provide? So those are things like intermediate things, like would we expect participants to improve or to increase their physical activity? Would we expect people to socialize more or share experiences? And then on the more population level, so this idea of scaling up nature-based therapy, we were interested to know about things like, would we expect an increase in the number of programs provided or the number of participants who could benefit from this sort of program? And then in terms of outcomes, so what change do we want? We were thinking of more things like changes in feelings or memories, changes in sense of belonging, changes in things like developing an affinity for gardening. So basically results that we would like to see in participants themselves, and then results that we would like to see at a more systems level. So things like an increase in interventions that address different dimensions like physical, emotional, mental, social, and existential well-being. Pardon. So in the end, yeah, so I decided I'm not to just present the theory of change, which is a lot of words, but this was the process we went through to understand how the people in both the people in our consortium and the people in, we also submitted we also asked people in our sister projects consortium to complete the survey. And so now Paula's going to tell us a bit more about, oh wait, no, I think we have another poll now. Sorry, Antonella. Yeah,
it's fine. Thank you so much. It's great to see how much we're doing within the project. Let's say that our poll now is trying to understand what our audience think causal pathways are within nature-based therapies. Thank you, Olivier, for launching the poll. We want to see which type of elements do you think have played the strongest role in improving mental health outcomes. Again, if you think that none of these answers fits what you're thinking about, please feel free to share it in the chat. In the meantime, I've seen that there was a question from Ida in the chat about how would you define a trained facilitator. I think maybe Helen, you can take this on while we wait for the poll's result.
You can keep on going with the need to define terms. And trained facilitator. I don't think we as a group came up with a specific definition of a trained facilitator, but in part because we're working across different countries and as an international project. And one thing that we found, if you attended our last webinar, might have come up, is that there's a real lack of standardization in terms of training or in terms of sort of certification of nature-based therapy providers in most countries. And so the training that one might receive differs. I can tell you that in general that most of the, or maybe all of those who are implementing the studies we're evaluating have some sort of certification in horticultural therapy, forest bathing, or whatever is relevant to their context. And I can't really comment on others, their background. We're collecting information on their background, but I cannot comment on how their training might be similar or different, because coming from different countries, they might have gone to programs or received certifications with quite different content.
Indeed. Thank you, Helen. And I mean, we've noticed with our project and in general that contexts do matter. we really need to contextualize whenever we do research. So I think we can share the results of this next poll. Let's see. Well, as expected, we have all the combination of all three. Indeed, it kind of mirrors what Helen just guided us through with her presentation. So without further ado, I leave the floor to Paula, and thank you.
Yeah, hi, thank you, Antonella. So yeah, Helen, if you want to go through the next slide, and then yeah, a little bit also with the last poll that Antonella showed. First, before starting with all the measurements that we are collecting, it's also important to know that, as Helen has mentioned also, is that we are collecting information on the training or the profile of each of the facilitators that are in the interventions that we are evaluating. And also we are collecting information on the natural environment. So we will have information on how is the space in which each of the interventions is being conducted, also on the biodiversity of these spaces, and also we are collecting information on the type of activity, because what we are doing is that basically each of the sessions that we are evaluating of the interventions, the facilitator is going to express which activities has been conducted during the whole time. So if the session lasts 1 hour, we are going to see if during that hour, how much of the time the participants have been doing one activity, how much of the time the participants have been doing another activity. So it's kind of that as much as possible, we are trying to collect a lot of information on the context and in which situation is the activity being conducted. And basically, this is kind of information and data that we are collecting, not from directly the participants. We are collecting this information from the facilitators. And in relation to the data that we are going to collect from the participants that are doing these interventions, we can find some of the measurements that are related to health. If within the seminar there's people who is working on this, researchers, academics, or even people who are doing this kind of nature-based therapies, maybe you're interested on the fact that we are collecting information on self-perceived stress. We are also collecting information on quality of life, emotional well-being in all of the interventions that we are evaluating. Then there are some of the interventions that they felt that their participants might be more able to answer other scales. So we are also collecting on some of the interventions information on anxiety, on sleep quality, emotional regulation, self-esteem, depression. And even in one of the interventions, we are also collecting information on grief, because of the profile of the participants. So it's basically that at the moment we are collecting, well, for me, like a lot of information, which one of the important things is that is being conducted in the same way in all of the interventions, even though the interventions are held in different countries. And also we are collecting this information not only at the beginning and at the end of the intervention. We are also collecting this information 1 month after the people has finished intervention, and then 3 months after this the intervention also has finished. And then besides of these variables related to mental health outcome, which is kind of the main aim of the project in which we are working, we are also collecting information from the participants on how connected are they to nature, which was something that we also thought that it might have an impact on the participants and their experience doing nature-based therapy. We also have information on the perceived biodiversity that they are in contact when they are doing the nature-based therapy, and also if they perceive that nature is giving them like benefits or not, which is also something that we felt it was important to know. And finally, as Helen mentioned, we have also this perspective on health equity and environmental justice. So we have been trying to be respectful and inclusive also on how we are collecting data on sociodemographic information. So we have tried to choose questions that are respectful for the participants, on collecting information on their identified gender, also on stigma that they might feel during their day-to-day life, discrimination, any experiences of marginalization due to For example, their age, their mental health status, also on the way that they dress. So we are trying to give like a lot of participation from the individuals that are doing the interventions. And also we are trying to collect information on education, income, and also sexual orientation. So we are collecting all of this information through surveys that are using like a program that it's called Qualtrics, that it's a software that maybe some of you know. And also we are going to conduct some interviews to have not only this quantitative information, we also are interested on qualitative information to complement both type of data. So if you want, Helen, you can go through the next slide that is related to the fact that, as I have been saying before, is like we are collecting a lot of information. All this information is being collected in the same way in all the interventions. All the scales are the same ones. So the thing was that even though we are evaluating interventions in different countries, what we wanted to try to reach at the end is also the possibility to compare across these interventions. So not treating these interventions as isolated interventions, we wanted to treat them as a more group of interventions that are using like nature-based therapies. So we have been seeing that previous studies also, most of them has these heterogeneous results in which they focus on a specific nature-based therapy, which in most of the cases is not a real-world intervention. It's more like a new generated or created intervention due to the fact that the project has money to do this intervention. So in our case, we want to evaluate real interventions that are active and that they, at the moment, they have sustainability, economical, and in relation to human resources. So comparability in our case is like we have this methodology that all the interventions are following the same protocol, which will give us reliable evidence, and also it will also help us in the future to validate our interventions through this replication. We can do more or less like direct comparisons instead of trying to understand the results in a fragmented way. So we will be able to, as I mentioned, study these interventions in a more common way. And also the fact that we will be able then to conduct a meta-analysis and then build a cumulative knowledge instead of more fragmented or isolated. And for our next slide, it's related to the fact that how this comparability links to credibility, which is something that we are interested on because we want the aim of the project is also to scale up everything that we are evaluating or helping to scale this up, and also trying to see how it can be implemented in more places. So based on what I have been explaining before is like this evidence for us is going to be like this kind of rigorous and standardized evidence, which will help then to justify why we need to allocate resources for nature-based therapies. Also the fact that in some cases funders, they are more into data that can be meta-analyzable than not heterogeneous studies that are diverse, that are different. And also the fact that as I mentioned, these interventions that we are evaluating are real-world interventions. So we have the information on how the intervention is working, how the intervention is being sustained from an economical point of view, and the human resources that are being included in the intervention. So this might give information for other interventions wanting to do the same interventions. So they know how much the intervention costs, which people is doing the intervention. So then we can scale up these interventions. So basically what we are trying to go is not just stay on the evaluation of the intervention, the aim of evaluating the intervention is to go a little bit further on this. So try to scale up these interventions and also implement them or promote the implementation of them in other in sites in the countries. Yeah, I think that now I feel that we have this other pool, no, Antonella, about evaluating.
Yes, indeed. We have questions in the chat. I think it would be good to address them before the poll. We have 2 questions related to the beginning and the follow-up questions that you have for the interventions. So the first one is asking if at the beginning, if you recorded who referred the people that took the intervention, clinical, self-referred, doctor. The second one is about the follow-up question, is if you have asked or if you're planning to ask the intervention if they have joined other green care activities or self-guided things, growing at home, going for walks, etc. And the third question is about the choice of the PSS-10 type of test. If you could elaborate a bit on this type of choice.
Yes, so for the question about who have referred the people to interventions, in each of the countries, the system is different, but we have the information on who have referred those people into the intervention. For example, in Spain, the people that are doing the interventions are people who has been referred by clinical doctors from the hospital because they are in a day center, so they might have come from the acute unit from the hospital, and they are not on the point of, for example, working or so on, but they can sleep at home, but then during the day they are going to this day center, and basically it's people who has, for example, went to a medical health center in Spain that it's primary care center, and then they have referred these people to the day center. And also, for example, in Italy, we have more presence of people who has been referred by the social services instead of medical services. So we have all this information, and the thing is that in each country, the way in the people that the people is referred is the same, but it differs between countries, depending on the circuit that also the country has for referring people to these interventions. And then with the follow-up questions, yes, we are collecting information in each of the points, the time points, about what other green care activities the people is doing. So if they are also joining other groups of people, for example, for going to walks during the week, if they do any other nature-based therapy, or for example, if they have any contact with nature at all during their week. So basically in GreenME, we have these 3 levels of nature in everyday life, nature-based promotion, health, and nature-based therapy. So we want also to have information in each of these 3 levels for all the people who is participating in the intervention, because we also want to see maybe if it's not the intervention itself, maybe it's the other exposure that they have to nature, for example. So we want to be able to see if it's one thing or the other one. And finally, this question about the PSS-10. Well, I have to say that I'm not an expert on psychology, but the thing is that when we were creating the survey and we were choosing which mental health outcomes we wanted to assess, we were trying also to see that as I mentioned, we have different interventions. So we were searching for a scale that was collecting information on stress, but was collecting information on stress from a self-perceived perspective, and like that was trying to collect information not from the same day, that was trying to collect information on the general status of stress that the person had in the last month, 2 weeks, and also in a way that in our case, the PSS10 is also used as a criteria of inclusion in our study. So all the participants that we have in our interventions have a score of higher than 14 on PSS10. So it means that it's people who has from the moderate to a higher level of stress, self-perceived stress. I don't know if I have answered your question, but for us, this is kind of the main reasons for what we choose PSS10 as a test for evaluating stress.
Thank you, Paula. Thank you so much for answering these questions. I think we can indeed launch the next poll. The idea here, we have heard from Paula during her presentation that there are a lot of challenges that we need to take into account when we try to evaluate this type of interventions. We would like to see whether you are aware of the type of challenges that you would face within your context. We've seen before that within our audience there are some health practitioners, there are also policy officers, there are researchers. So even if you don't know for sure, maybe you can imagine what the challenge or challenges would be. It's a single choice here, but again, if you have more to add, please feel free to post it in the chat. Olivier, as always, feel free to close the poll when you see that most of the answers have been collected, so we can share the result and see what our colleagues in the audience think. Okay, we have 60% of responses so far, so we give a few extra seconds. I really appreciated this last bit, Paula, about comparability leading to credibility. I think it's key, and it's very important that we show that the multiple contexts within our project can work together and are a key element to foster and promote mental health and nature-based therapy. Thank you so much. It was a very powerful message, I think. I believe we can close now the poll and see where we're at. Okay, so we have a few challenges here. Okay, how to reliably measure mental health and well-being, comparing results across different programs, how to follow up in the long run with participants, the various factors. Context plays a crucial role every time. And then economic or cost effectiveness evaluation, which I believe it's something that we will touch upon in the next minutes. Wonderful. Thank you so much. And I give the floor again to our panelists.
Yeah, thank you. So yeah, this last part, we are going to share it with Helen. that is going to talk a little bit on this part of cost effectiveness. But before, we just wanted to give you a brief information on the interventions that we are evaluating. So basically, at the moment, we have a total of 7 interventions, if I'm not wrong. 2 of the interventions are being held in Italy, in Bologna, which are called Saluspace and Batirame. In both cases, they have participants who have been referred by social services, and they might be people who are unemployed at the moment, and they are doing, in both cases, horticulture therapy, gardening. And then we also have another intervention on horticulture therapy, which is in UK, that it's called Northern Roots. And also another one in Hospital de Mataró, which is in Spain, that it's this one that I have been talking about, that they have people who has been attending to the day center, because most of them have some mental health disease, and they are conducting this horticulture therapy on their day-to-day activities. And then we have this other intervention that it's surf therapy that Helen mentioned, that it's called Tonic, which is also in UK. And then we have 2 other interventions that are doing this forest-related therapy, which is forest bathing, that are held, one of them in Spain, with participants that have been diagnosed with prolonged grief. And then we have this other forest bathing intervention in Sweden. One of the good things of these forest bathing interventions that we are evaluating is that in both cases, the people who is facilitating the interventions, they have been talking to each other before starting the interventions, mainly the responsible of the intervention in Sweden and the one in Spain, because they are trying to follow kind of the same way of doing the forest bathing interventions, because both of them has kind of the similar training. So on that side, we will not have a lot of difference on the activities that are being done. And in all of the cases, the people that is doing the interventions, they are participating in a total of 12 sessions, which in some cases means that they are doing the intervention once per week during 12 weeks. And we have one intervention that, due to logistical and timing issues, they are doing the 12 sessions, but in 6 weeks instead of 12 weeks. So they are doing twice a week the intervention. And most of the interventions are between 90 minutes and 120 minutes, depending on how the intervention was being conducted before GreenME, because as we mentioned, all of them are real-world interventions. So we have been trying to adapt the protocol to the interventions, but we also needed to adapt our protocol to the interventions to not change what they were doing until the moment. And yeah, next slide, it's basically talking before Helen explains a little bit on the cost effectiveness. It's like to explain a little bit that we are doing a randomized clinical trial, but we call it like real world randomized clinical trial, because some of the things from a randomized clinical trial we were able to fit, but some of them we were not able to fit because of the fact that we are evaluating real world interventions. But basically, from all the interventions, a group of people is invited, and then after they are screened, they are invited to the study, they are recruited, and then they have to complete this, what we call a baseline survey, which is the first baseline, the first survey that they need to answer. And after completing this baseline, the people is randomizedly allocated to one group that is going to be doing the nature-based therapy, and to another group that is what we are calling kind of the control group, which is basically that the people in that group are doing what is known as treatment as usual. So we are not forbidden the people that are in the control group to receive any treatment. It's basically that they are receiving the same treatment that they will have received in the case that the nature-based therapy hasn't existed. So then the outcomes have been measured, the same ones in both groups, experimental and control group. So we have the same information for both groups, and the idea is to see if we have we observe any difference between them. And yeah, Helen is going to talk about the cost effectiveness part.
First, a disclosure that I am in no way an expert on cost effectiveness research, but I'm going to try to explain what our colleagues at the Autonomous University of Barcelona, our university, are going to do in this regard. So basically, we know that the cost of any intervention is very important, along with, and maybe more importantly, is the part that Paula described, which is how do you prove that an intervention works? How do you, meaning in this case, how do we prove that an intervention may improve someone's mental health? But the other aspect that's very important when trying to convince a healthcare system to scale up an intervention is it more expensive than what we're already doing? So it's not just about actual costs, but about comparing the cost of nature-based therapy to the treatment as usual. And oftentimes these types of analyses are tacked on to a randomized control trial, because in the case of, for example, the ones that we're doing, we have these two groups, the ones that are receiving the intervention and the ones that are receiving treatment as usual. And so along the process, we're also collecting data that allows us to estimate approximately how much nature-based therapy costs and how much treatment as usual costs, and then calculate compared to the change that we see in those groups in their health. And so the two types of changes are, one, changes in quality of life, and then two, what they call quality adjusted life years. So quality adjusted life years are something that aims to understand not just how much longer someone might live, but how much longer in a state of good health and well-being might someone live if they were to participate in an intervention. And so the two types of cost-effectiveness therapy, cost-effectiveness analysis aim to, one, understand what's the cost of nature-based therapy per year of good quality life gained and per unit of improvement in quality of life. And then how do those compare to the costs with the treatment as usual, assuming that treatment as usual also works to improve someone's health. And then in the end, we compare them. And obviously the ideal scenario is that nature-based therapies are both very effective and are less expensive than the treatment as usual care. But we also have categorized other situations where, maybe they're equally as effective, but nature-based therapy is less expensive, or to the contrary, maybe nature-based therapy is equally as or greater effective, but more expensive. Or maybe it doesn't work as well and it's also more expensive. So you kind of get the idea. And then we're also comparing sort of those cost thresholds to general spending patterns in the different countries that we're working in, to understand whether the cost of the intervention fits well within the amount that a healthcare system might be willing to spend on something like nature-based therapy. So that's it, as I understand it.
Thank you, Helen. I think it was perfectly clear. I do not see questions in the chat yet, but in case they come, we will address them. We've had a very, very interesting presentation from our panelists. We've dived into different aspects of the work that Work Package 3 is carrying out. Now we would like to see with our next poll if there is a specific result that is that resonates the most with the work of the people in the audience. So what's your main takeaway, let's say, from this presentation? And then we see if there are additional comments in the chat. John, it's about more like what type of theme that has been addressed in the presentation would be useful for your work, like result intended in that sense, if that clarifies. So what resonated the most from the presentation, from what Paula and Helen talked about with you and for your work? We've seen that you have a kind of like a particular practice which integrates humanistic counseling using nature as a complement to your session. So probably these items do not resonate or do not fit 100% within your field, but let's see. Or as no, I will not. Okay, sense of self-worth of community. Thank you, John. Okay, we have 65% of responses so far. We wait a few seconds more. And then the idea probably is it's gonna be your favorite part of the of the webinar, of the interactive part of the webinar. We have open questions for our audience. We have 2 open questions, so it's gonna be a sort of huge conversation without spoken words, but it's gonna be all written, so we can build on that. We have another comment from Claire. Okay. I think we can close this poll at the moment. We see. Okay, so focus on well-being, effectiveness, value for money, evidence on how interventions work, a little less about equity and gender-sensitive results, which we understand it's a huge part of our project, which might not be covered in general or not being a pillar in other cases. Thank you, Olivier. We can launch also the questions now. So we can have a few minutes. This is how we can, how we can guide an open discussion within a Zoom webinar environment. We are not seeing us face to face. We cannot hear your voice, but we can hear your thoughts or read your thoughts. So from what was presented, how could work package 3 evidence support decisions in your context? It's an open question, so feel free to frame it in the way that suits you best, and what would make this evidence easier to use in practice. So we can give you like 3 to 4 minutes to complete these questions. In the meantime, we're gonna post in the chat the link to subscribe to our newsletter in case you haven't done it yet. You're missing out on an amazing piece of news about our project. So please do subscribe. Our newsletter item is gonna be published. Our next newsletter item is gonna be published in March. And if you follow us on social media, you will have all the relevant updates about news and events related to our project. Barbara, work package 3 is the work package that Helen and Paula are leading. It's what we presented today during the webinar. I think you probably joined a bit later, so thank you for your question. Hope this clarifies. It's about cost effectiveness and causal pathways and evidence related to nature-based therapy. I don't know, Paula, Helen, maybe you want to summarize what work package 3 is about so we can help Barbara out with replying.
Sure. So work package 3 is part of the GreenME project that focuses on evaluating the effectiveness and cost effectiveness of nature-based therapies specifically.
Thank you. Okay. We have a couple of minutes more. For those who have already answered in the questions, would you mind disclosing in the chat how you came across this webinar? If it was because you are subscribed to our newsletter, if it was social media, if somebody decided to tell you, hey, there is this thing going on, you should join, that would be very helpful for us. Thank you. Okay, so words of mouth, social farm and gardens, who are our partners in this project, LinkedIn, okay, the April network, so with Michelle, GreenME newsletter, music to our ears. That's great. Thank you for sharing. Okay. Thank you, Joanne, for sharing also. Thank you, Alberto, on LinkedIn. It's indeed our stronger social media platform, our strongest, actually. Olivia, how many answers do we have in? Can we close the poll or not yet? Also, the poll, the magic of being a non-native speaker, with the accent. Okay, we have someone from Neurolandscape. Great. Okay, we have nine answers so far. Do people need more time, or you can just say yes in the chat or no? Let's give maybe 1 minute more. And then we try to see what we gathered so far. For the next webinar, we should implement some like kind of background music for this silent moment. You know, when you're waiting for a call center to reply to you, we should do that. Yeah, if you have a jingle, please send it our way. We will use it next time. Okay. Bird song, yes, why not? Bird singing, okay, sold. Next time we will have bird singing. For sure, better than me saying random sentences to to cover the silence. Okay, I'd say that Olivier is rightly suggesting that in case you haven't had the chance to follow the previous webinars, they will be they are available on our website. You have the link in the chat now, and also this webinar has been recorded and is being recorded and will be available shortly after the end of the session on our website. Okay, I would say like let's have a question. Let's have a look at the answers. Oh, we cannot see. That's a bummer. Olivier, can you see the can you see the answers? Do you mind? I don't know. Maybe you can share your screen. We can have a look. Yes, thank you. Thank you. We're gonna share the screen, so at least, okay, that's cool. So what do we have? How could the work package 3 evidence support decision in your context? We have with evidence officials and politicians and doctors would be more willing to make decisions that lead to scale up and participants to my business. Convince the institution. It's one of our main targets here to have some influence on decision makers and policy makers at different levels. Okay. How to plan green interventions. That's great. We have a very, very great intervention environment going on. Proper evidence will assist in design degree course. It can be studied, absolutely. European studies on effect of nature therapy is very important. On this, Turi, I invited you already. Sorry, I hope I'm pronouncing your name correctly. Invited you to join our EU Green Care Network, where we will try to put together people around Europe. Also, we would like to invite you to have a look at our sister projects that were mentioned by Helen at the beginning. We are all funded under the same cluster from the Horizon Europe funding system. We have two other projects that are Nature Lab and Resonate, and then we have a sister-in-law project that is Recetas. Information about them are also available on our website under the tab Sister Projects. So please go also have a look at what they're doing. It's a full machine working together on different aspects of the same topic. So it's if you're interested in what's going on and what's been financed by the European Union, please do have a look. Okay, so about question about the information about similar practitioners and research, I think it would be good to have a look at the deliverables we have published from work package 2, where there is a mapping of green characters. You have already a map that is available, like an interactive map that is available on our website. However, you can also have a look at the deliverables that have been published and that are also divided by area and go more in depth when it comes to practitioners and research. European-wide campaign, yeah, it's mostly what we're doing with this project with the causal and dissemination work package. They are divided by study area. Okay. Yeah. What would make this evidence easier to use in practice? Let's see what we have here. Believe in what you do. That's a great model. Categorization of solution and effectiveness, how they can be implemented and budgeted. Detailed description of intervention methods. Okay, then we have Michael undertaking a social impact assessment, which collects data centrally, so you can analyze your results. Okay. Okay, not relevant. Then simple analysis of impact and cost effectiveness published in your web and through brochures. Okay. Yes. Hi. Okay. Yeah. Brianna is a storyteller in the chat. That's good. Please network and connect. That's great. Okay. Thank you. Thank you so much for answering our questions. Even though some of you were shy and didn't write it down, it's okay. We appreciate you being here. Propose this solution in hospital. Yes, that's great. That's great insights. But we're trying. We have as one of our main target audience also medical practitioners and health institutions, namely hospitals. That's one of our main goals, to have them prescribe green therapy in the end. So if you know your local doctor, you can also say, hey, there is a project that says that green therapy is very, very good for mental health. You should have a look. And so we created this very, very wide network. We have a final poll for you. This is mostly for us. We would like to understand that we called it a confidence check. We want to see, after this amazing presentation from our panelists, thank you again, Helen and Paula, how confident you feel using evidence on nature-based therapy in your work. So please, Olivier, share the last poll. And hopefully you feel way more confident than before. But if not, cool. It's it's important for us to see how part of our research is received. However, please follow us. Feel free to contact us from like via the email we shared before. If you have specific questions for Helen or Paula, we will redirect your questions to them. Proofs of green therapy, scientific proofs. Absolutely. Yes. Okay. Olivier, let me know when we can close this and see the results. Okay, we have half of the people, 60%, oh no, more, 60% voted. Let's have a couple of seconds more. And then we can share the results. Okay, I would say we can close this. Okay, so we have more than a half that are feeling somehow more confident, someone about the same. So we believe you were very strong and confident using evidence already. Okay, not relevant, probably for Joe. And okay, thank you so much. We'd like to thank you, all of you, for participating in participating in this. Thank you so much for being so active in the chat, for sharing your thoughts, for taking our polls and open questions. Thank you so much to our panelists, Helen and Paula. It was great to have you. And please follow us, follow our project, and our next webinar will come in the upcoming months. So keep watching, and thank you so much. Have a good day.
Thank you, Antonella.
Thank you. Bye.
Bye.